Let's get started with different types of hypersensitivity. Generally, we have 4 types of hypersensitivity. And what are hypersensitivity? Well, they are when our body is reacting to an antigen or a foreign body in an exaggerated manner, which leads to harmful effect on our body. We generally have 4 types of hypersensitivity. The first type, or the anaphylactic type. The second type is antibody-mediated type 2 hypersensitivity, immune complex hypersensitivity type 3, and the last one, the delayed hypersensitivity or cell-mediated type 4 hypersensitivity. Type 1, 2, and 3, they're all antibody-mediated, but type 4 is cell-mediated, is the only hypersensitivity that is cell-mediated. If you want to remember types of hypersensitivity, you can do it by A, B, C, D. Anaphylactic, antibody, complex, and delayed type hypersensitivity. Now let's go and discuss each of these hypersensitivities more in detail. In type 1 hypersensitivity, our body is making these IgE against these antigens that have entered our body. Now, the cross-linking that happens between antigens of IgE and mast cell leads to immediate degranulation of mast cell, which then cause release of histamine and tryptase and other mediators that lead to the presence of allergic reactions in the body. Now, tryptase is a marker of mast cell activation. There is also a late phase which happens after hours. It's due to release of chemokines that attract inflammatory cells like eosinophils and other cells that mediate such leukotrienes. Inflammation and tissue damage also are present in the late phase. Examples of hypersensitivity type 1 is anaphylactic shock. It can be due to drugs, induced by drugs, bee stings, allergies, or food. Now, the tests we can perform are skin test and blood test ELISA for allergen-specific IgE. Alright, hypersensitivity type 2 is mediated by antibodies, and these antibodies on our cells bind to antigen on surface of abnormal cells, which leads to either cellular destruction, inflammation, or cellular dysfunction. In cellular destruction, cells are opsonized and coated by antibodies, leading to either phagocytosis or activation of complement system. Also, natural killer cells, they are killing these cells via antibody-dependent cellular cytotoxicity, or ADCC. Example of that can be autoimmune hemolytic anemia, immune thrombocytopenia, transfusion reaction, and hemolytic disease of newborn. Now, when we are talking about inflammation, which is also a consequence of hypersensitivity type 2 reaction, here we are talking about binding of antibodies to cell surfaces. This leads to activation of complement system and Fc receptors that are mediating inflammation. Example of this is G3, good posture syndrome, rheumatic fever, and hyperacute transplant reaction. And why I'm saying G3, because good posture syndrome starts with G, glomerulonephritis as a result of rheumatic fever, or A2 stroke pneumonia can happen, and also graft rejection due to transplantation. Now, what happens here is that type 2 hypersensitivity leads to inflammation, and that causes activation of a complement system. This leads all of these complement system to get activated and start lysing the cells. The last sequence of type 2 hypersensitivity is cellular dysfunction, and here antibodies are binding to cell surfaces receptors, which causes abnormal blockade of activation of downstream processes. Now here what we are dealing with, I know it sounds a little bit difficult, but let's imagine the conditions like myasthenia gravis, where these antibodies are formed against the receptors of acetylcholine, which leads to presentation of all those symptoms that these patients present with. And also in Graves' disease, where these antibodies are formed against the thyroid tissue. And the last example is pemphigus vulgaris. The next hypersensitivity type we are going to discuss today is type 3 hypersensitivity, and it's immune complex. So it's antigen and antibody, mostly IgE complexes, both together will be deposited in the tissue, which then later on leads to activation of complement system, and it attracts neutrophils, and neutrophils release lysosomal enzyme, which leads to destruction of the tissue. So the difference between hypersensitivity type 2 and 3 is that in type 2, these antibodies are directly attacking the tissue, but in hypersensitivity type 3, these immune complexes, antigen-antibody complexes, are formed and deposited in the tissue, which later on leads to complement activation. In type 3 reaction, three things are actually getting stuck together. The first thing is antigen, second is antibody, and then the complement. Here you can see how they are formed. So I said that three things are stuck together. The first one, antigen, antibody, and the complement system together, which then attracts the neutrophils and leads to lysis of the cell. An example of third hypersensitivity can be SLE or systemic lupus erythematosus, polyarthritis nodosa, you can see the picture here, and the post-streptococcal glomerulonephritis. Now, what we are dealing with when we are talking about hypersensitivity type 3, one of the classic presentation of this hypersensitivity is serum sickness, and this is when antibodies to foreign protein produces within 1 to 2 weeks later after the first exposure, and these antibody-antigen complexes form and deposit in the tissue. Now this leads to complement activation and inflammation and tissue damage. Now this is circulating in the body and getting deposited in different parts of the body, so it leads to a manifestation of systemic kind of disease where we have fever, urticaria, arthralgia, and proteinuria, lymphadenopathy, and many other symptoms. The other presentation of hypersensitivity type 3 is Arthur's reaction. This is more of a local subacute immune complex mediated hypersensitivity reaction where intradermal injection of antigen into a perisynthesized patient or perisynthesized person has an current circulating IgG in individual, and that leads to presentation of Arthur's reaction. This leads to local edema, necrosis, and activation of complement in that specific part where this patient who has been previously pre-synthesized is now reacting to this antigen. Now the last one is hypersensitivity type 4. Finally, we are here talking about a delayed kind of hypersensitivity where it's cell mediated and it's very different to the other three ones, because there we were talking about antibodies forming against an antigen, but here we are just talking about the cells reacting to this. Now two mechanisms, and in both of these two mechanisms T cells are involved. The first one is direct cell cytotoxicity, where CD8 cytotoxic T cells kill the targeted cells. And then the next one is inflammatory reaction, where effector CD4 plus T cells recognize antigens and they release these inflammatory inducing cytokines, where then leads to the presence of hypersensitivity reaction. Now here, the examples can be contact dermatitis and graft versus host disease tests that are used nowadays, and they are based in hypersensitivity type 4. You can be tested on that in different examinations. The first one is PPD for TB or tuberculosis infection, patch test for contact dermatitis, and candida skin test for T cell immune function.